Sometimes I have women who come into my office who are pregnant and they want to know how this is going to affect the application for citizenship. This can affect the examination process in several ways. First of all, the medical exam and the medical history are the same as always. However, the tuberculosis testing may be a little bit different. The tuberculosis testing can be done because the blood test and the skin test are both safe to do in pregnancy. Neither one will harm the mother or the baby, even if they're positive. However, if you have a positive test, the next step is usually to have a chest x-ray to assess for tuberculosis. A chest x-ray is usually contraindicated in pregnancy. That means most pregnant women don't want to have a chest x-ray. What this means is that you won't be able to complete the USCIS medical exam until the end of pregnancy. Some women go ahead and submit their applications to Homeland Security. You can do this so that they go ahead and have your information on record. However, they will send you a letter saying that they need to receive the chest x-ray results and the final assessment on your tuberculosis before they can complete your application. If you decide to go ahead with the chest x-ray and have treatment for tuberculosis, then the civil surgeon will make sure that you have medical treatment for tuberculosis that is safe for your baby. This is something that's very important to discuss with the civil surgeon to decide the proper way that you want to proceed. The next step is the syphilis blood test. This doesn't pose any risk to the mother at all. It's a simple blood test. The important thing about the syphilis blood test is that if you have a positive syphilis blood test, you need to be treated. Syphilis can cause health problems for the mother and for the baby, so you need to go ahead and be treated for this in pregnancy if it should come back positive. Fortunately, this is a very rare situation, but if you're one of the people that have a positive syphilis test, then you definitely need to know as early as possible in pregnancy. The final part of the USCIS exam that causes the most concern is the vaccinations. There are some vaccinations that cannot be given in pregnancy, especially the measles, mumps, and rubella vaccination. This vaccination can cause birth defects if given in pregnancy. Most pregnant women will be tested for measles, mumps, and rubella when they go in for their first obstetric exam. So you might check with your obstetrician to see if you had this testing done. They do a blood test called a titer that checks to see if you're immune to measles, mumps, and rubella. This is because measles is a condition that commonly causes birth defects. If the titers are positive, this means that you are immune to measles, mumps, and rubella, and you can provide that to the civil surgeon instead of having a measles, mumps, and rubella vaccination. If the titers come back negative, however, you need to have the vaccination. You cannot have this vaccination during pregnancy due to risk to the baby. The other vaccination that you can't have during pregnancy is for varicella or chickenpox. But many people have had chickenpox in childhood, and so this poses less of a problem. You want to check out the vaccinations carefully with your civil surgeon to make sure you do what's right for you and for your baby. Again, you can submit your paperwork before it's all complete. However, Homeland Security will contact you and they will not proceed with the complete application until they have this information that will be done at the end of the pregnancy. If you have any questions about any of this as you go along, then please discuss this with your civil surgeon. And if you're pregnant, it's very important that you let the civil surgeon know as you go through the exam process.